All right, 12 lead EKGs. The purpose of a 12 lead is to enable viewing the heart from several angles, from localized sites of cardiac injury to identify dysrhythmias and other abnormalities. I think we're going to get into heart attacks now. Indication: chest pain, discomfort, electrical injury, known or suspected electrolyte imbalance, known or suspected medication overdose, RVF, LVF. What is that? Right ventricular failure. Left ventricular failure. Stroke, syncope, near syncope, almost passing out. Hemodynamic instability of unknown etiology. Don't know what etiology is. I should look that up. It is the study of etios. I don't know what an etio is. Device capable of recording 12-lead EKGs contain interpretation software. Rely on your own interpretation, not the automated findings. Some devices are also capable of transmitting ECGs to the medical facility. All right, so indications: we have chest pain, discomfort, we have electrical injury, we have known or suspected electrolyte imbalances, known or suspected electrical overdoses, RVF, LVF, stroke, syncope, near syncope, I can't say this word, hemodynamic instability of unknown etiology. I just read all this. What is this? Device capable, yes. Okay, acquisition modes. Monitor mode or diagnostic mode. So for rhythm interpretation, ECGs are recorded in monitor mode. Use of electronic filters to remove artifact and other unwanted information. Can skew shapes and locations of the ST segment and the T waves. Capture range from 1, 30, 40, 100, or 150 hertz. Actually, what was this? Okay, yeah, everything I just said. All right, diagnostic modes filter out very little electrical information. So there's more artifact on the tracing. Captures electrical information within the range of 0.05 to 150 hertz. Used to record a 12-lead EKG by default and cannot be changed. Possible to record a 3-lead EKG in diagnostic mode. Frequency range near the bottom of the ECG tracing. 25 millimeters per second. Yes. Lead placement. The best way to learn how to record a 12-lead ECG is to practice with equipment. So when positioning the electrodes, make sure that the patient does not get chilled, as shivering will cause artifact. Any movement, tell them not to talk, tell them to just sit there and relax. 12-lead ECGs are more sensitive to artifact than 3-lead monitoring. I'm going to say EKG. I keep saying it sounds weird. To properly acquire 12-lead EKG, refer to your skill drills. All right, so whenever we approach the 12-lead, let's see if this is important or not. I want to get to reading. Okay, I guess this is. So there's a 7-step method whenever you're doing a 12-lead. You're going to review the snapshot. You're going to interpret your dysrhythmia. You're going to determine the axis of electrical activity, and you are going to identify the conduction system disturbances. You're going to evaluate the chamber size. Review for zones of ischemia, injury, and infarction. You're also going to identify the non-cardiac causes. So review the snapshot, look for the tracing, and see if anything stands out. Check that all leads are printed and artifact is present. Okay, so generally, whenever the heart has electrical activity that happens through it, right? Like you have your brain, which is, it's not a battery, but it's kind of like a battery. It's where all your electrical activity is coming down through your central nervous system to the heart, telling it what to do. And then you have all your conductive electrolytes that fire and repolarize, depolarize. Electricity is going in all different kinds of directions, right? But generally you want to go from here to the ventricles. Well, your heart isn't like, you know, a heart in cartoons where it's straight up and down, right? Like it's angled slightly this way towards your left, is if you're going to give it a direction. So that is the direction that electricity is generally traveling. Starts from here, SA node, AV node, Purkinje fibers. So most electricity is firing generally in that direction. This is your vector. A quantity such as a force that has a magnitude and a direction. QRS axis, a single vector that represents the mean is like the average of all vectors created by ventricles during depolarization. So it's viewed from lead 1 of the QRS QRS wave, and you're going to have a positive deflection if heading towards the left arm. You're going to have a negative deflection if heading towards the right arm. So left arm, right arm, lead 1, QRS. This is confusing to look at. Okay, lead 1 over here. Lead 1 is going negative to positive, positive deflection, negative deflection. Okay, so we know if it looks like this, right? The QRS, if there's a spike, if it's going down, our back to basics, electricity is going away from the lead. If it's going up, it's going to the, towards the lead. This is complicated to look at. Okay, viewed from lead AVF, QRS waves will be a positive deflection if heading towards the patient's feet and a negative deflection if heading towards the patient's head. Okay, so yeah. So AVF is going straight down. That's the direction the lead's going. So it's going to be positive deflection. The QRS is going to be positive above the isoelectric line if the deflection is heading towards the patient's feet. Why? Because AVF lead is down here, pretty much where your belly button's at. That's going to be where the lead's at. So if electricity is going towards it, going towards the lead, that's going to be positive, positive deflection. QRS is positive. We know that that's the direction electricity is going. And then the antithesis would be negative if it's going away from the AVF lead. All right, that makes more sense to me now. I think I get what it's saying. Axis deviation refers to movement of the QRS axis to the right or left of its normal position. May provide important clues about the heart's electrical activity, but is not specific for any particular diagnosis. The faster method to determine the QRS axis involves using the QRS complexes in lead 1, lead AVF, to create a simple quadrant system. The intersection represents the impulse of origin with 4 quadrants where the impulse can travel. Impulse of origin. So electricity could generally travel in any one of these directions. Again, heart shaped this way should have electricity going towards the left, towards the bottom, generally at what, 30 degrees? Everybody's different, but that's why normal is going this way. Now, if electricity is firing generally above your 0 degree line here, then it's firing slightly to the left. Now, if it goes past your AVF 120 degrees, this is the direction, we know that electricity is going to the right. If it's all the way up here, it's extreme right. There's I don't really know enough about it. A lot of this is falling into what cardiologists study. You can use your thumbs as a way to determine. It's lead 2 and lead AVF. Or is it lead 1? No, lead 1. So you're going to look at your 12 lead, and you're going to have multiple leads, V1 through 6, lead 2, 3, AVF, AVR, all. Is my battery dying? Oh, my battery's about to die. All right, so if you look at lead 1 and you have a positive, then you're good. And if you look at lead AVF and it's going up as well, positive just like your thumbs, then you are headed in the normal direction.